My name is Dr. Namdev, and today I'm going to discuss about some of the very important aspects of USMLE STEPS preparation. The mistakes I made during the STEP 1 preparation, I will share the experience of these mistakes so that you may not conduct these mistakes and can perform better in your USMLE STEP 1 preparation. It's totally understandable that STEP preparation is very prolonging. It's a very prolonging exam, and you have to prepare very well for this. You cannot take a second chance on being on the safe side. You have to prepare well, but there are the things that we have to keep in mind. First, I will share my story, then I will give the important tips. In my case, I started my step 1 preparation immediately after my house job. Although I was studying pathology during my house job period to have a good grip on the diseases, and Pathoma was my main book for that, which is very in among students. But I did a very big mistake. I went for all kind of materials. Number one, I studied Kaplan. Just after my house job, I started listening to Kaplan lectures. Then one by one, I went through the chapters of Kaplan books like anatomy, physiology, pathology, and then I went for Pathoma. So after giving these subjects, discussing them with many colleagues, we used to study on phone call, online calls, and after that, studying for my Kaplan books, I went for the first aid material. The first aid material, which is very concise, but it requires very clear concepts. You have to go through different other resources to clear the concept of step one. So after completing my Kaplan materials, that took 4 to 5 months because there were a few of colleagues that took the ideas from those colleagues, and I got realized that their preparation was based on Kaplan material. So there was no guidance from the mentors or seniors. I didn't find any group which can guide to the students or who are preparing for step one. Although I used to study from the posts and the ideas shared by the people in the groups, but I was not very clear that which thing I should touch most. Having no past papers or like these things, like mostly we used to do in our prof exams during, we have some concepts that how the questions are presented. I didn't have any idea, but I had the NBMEs. From that, I got the idea that how the exams are prepared. But I kept the NBMEs in the end so that I can take those as assessments rather than using NBME as how the exams come. This was my one mistake. I use the NBMEs for assessments only, although I have old NBMEs, rather than using NBME for checking that how the questions come in the exam, how do they ask the questions, how the material presented. Because UWorld is a thing that is enough to prepare for the STEPS exam. So this was the only source in my later months to focus for exam and to rely for exam. So as I completed my Kaplan materials, I started my first aid, and with that I bought the UWorld. I asked from a few senior colleagues, and they told me the uh, to buy the UWorld for only 6 months. But when I bought UWorld for 6 months, then I was also studying for first aid keenly. In the first go or second go, we find it very hard to absorb all the material. So in the first go, although I have read the first aid maybe previously once, so the first go it was almost like the thing was memorable for me. So because the concepts were, some of the concepts were too tough. Not all the concepts, because we are familiar with that. After graduation, it's easy for you to get most of the concepts. But for my bad luck, I kept on studying UWorld for 2 years with my first aid, just because I was also doing job. And hospital where I was doing job, it was a very busy hospital where I used to deal a lot of patients. So this was the reason I was too passionate for the care of patient. So it was just like keeping my feet in the both boards. I was passionate for both the boards. to run both the boards together just because I was passionate about dealing my patient, learning on practical side, as well as I was passionate for clearing the steps exam. But in the end of my preparation, I realized it is very hard because when we memorize a thing on one hand, and on the other hand, we are dealing the patient practically, talking them in a different way on a practical pattern. Although it was helping me to grip my concepts and to be more clinically active, that was that I knew that it would be very beneficial in future for patient management. But I was doing a very difficult task. So after 6 months, my UL got expired. I was not done with the complete questions. I bought a UL again. Then I bought a UL again. I bought a UL three times. Basically. So this was all. But about UL buying, but my experiences are long. First up, when I used another thing, I first read Kaplan, first aid. I was also teaching some of the students first aid, in which they were difficult the units. I read the first aid 15 to 16 times. I used to write it in the start of my page that I've read this book once. Because reading first aid was not easy, so it usually used to take complete first month for the first aid to end. With the UL questions I was doing as well, I was also doing job with all of this. So reading first aid about 16 times was not right. uh, I was trying to take the materials into my long memory. Now, if you ask something from the first date, for me, I will tell you quickly. Till now, I need like 2 3 days to revise all the material, maybe. But most of the time, I remembered that this thing is on that this page, this thing on is on that page. So this was my style. But for behind this, there was so much struggle. Second thing I would recommend that do not use your all NBMA materials as an assessment. I had some old NBMAs from NBMA 1, 2, 3, 10, 11, 13, all the NBMAs. And when I took the exam, there was NBMA 20, 21, 22, 23, 24. These all NBMAs were there. So if you have these much assessment materials, never try to use these assessment materials. In the steps preparation, it is a little bit different. Use only 2 to 3 assessments. There is two UWS's assessment. There take 2 to 3 NBMS. And use all the NBMS as a reference that how you have to prepare, how they are asking the questions, because NBME is the side that give you a real clue about the exam. So this was another mistake. Second thing that I would try to recommend, uh, do not go into so much depth of the questions because it develops the habit of being overthinking. I had a habit of being overthinking. I had the habit of making a choice and then being kept on thinking. I used to keep on thinking of those points. First, I have marked my MCQ. I used to change that MCQ from B to C. Then this was the habit of being of a person who keep on thinking once the decision has been made. So if you are having that kind of habits, so please get rid of those habits. So this is my advice to you. Don't first read it only 2 to 3 times quickly just before your exam. Do not delay your exam. Just focus on your preparation in a very concise manner. Do not involve yourself into different tasks, jobs, if you can focus. But if you want to take your step one with the job, it will take 2 to 3 years maybe, because it all contains basics. You're not me, and the human memory is not that much fast that you can, like, if you have remembered a thing today, after 1 2 week, you may need revision again. So this is all about my step preparation. I hope this video would be helpful for you. Uh, Another thing, there is a match with the name of Match Guys. I think I shared the icon here. There is a YouTube channel that helped me a lot in my last day of step one preparation because I was not having an idea that how the step one uh, uh, you have to take. I was not developing the confidence of taking step one. So the Match Guys, they helped me a lot. I would like to convey my thanks to those Match Guys that have developed their YouTube channel. They shared a lot of things that were very helpful for me. So if you need, moreover, if you need my assistance for the first preparation, or if you are weak in any concept, I can help you within minutes. Uh, I can mentorship. I can give you free lecture on that in the start. But if you need continuous lecture, then we can decide on that. I will help you through my methods that were ineffective and finally the method that was effective. So this is all. And second, I will also try to help you about if you are weak in step 2 preparation or clinical concept, or if you are feeling demotivated. Um, because I have realized that while we are preparing for exam, another important thing is family stress. They don't understand that it is a very hard study, it's a very tough study. Second thing is that we are very second thing that I realized is that uh, we because a very long preparation we face depression, demotivation, and some of the students they complain that they are completely frustrated and are not able to focus because when you are depressed there can be many things about that. You may lack vitamin D or you have some other reasons. So important point is to rule out why you are depressed. Is it the prolonged study? Are you lacking any nutrients in your diet, or you are otherwise depressed? So this is all for today. This is all for today. I hope this video have benefited you in positive terms. So, Ashwin, I will come again with a new video and with new ideas. Thank you. Take care now.